Okay, good morning, everyone. This is Lynn Sutphin, Public Information Officer here at the Michigan Department of Health and Human Services. We are going to get started here in just a moment. Let everybody get in. If you want to record, please raise your hand so we can get that process taken care of really quickly. Okay, did I get everyone? All right, I think I have everybody who wishes to record, so we're going to get started. I'll keep an eye on this and continue to give that permission as needed. So again,
I don't have permission to record.
Okay, I will get you in just a second.
Yes, I'm asking to, please.
I will get you, as like I said, raise your hand and I will get to you here, but we're going to get started. Going to say this is a COVID-19 data update with Dr. Joneigh Khal. At the end, we will have an opportunity, a short opportunity for some Q&A. Everybody will be allowed one question. I'll ask you to identify yourself when I call on you, so we have this for the recording. So anyway, I'm going to turn this over to Dr. Joneigh Khal and let her get going and make sure I got everybody who wants to record able to record. Once again, if you wish to, please raise your hand.
My hand is up. I still can't record.
Okay, I will get to you in just a moment. Dr. Joneigh Khal, please take it away.
Okay, good morning, everyone. Can you hear me, Lynn?
Yes, I can hear you.
Okay, great. Thank you very much. All right, so let's go to the first slide, please. Thank you. So today we're going to be talking about increases in case rates and percent positivity, as well as some increase in hospitalizations. Currently, our case rates are at 144 cases per million people. Our percent positivity is more than 5.1%. The number of inpatient beds that are being used to treat COVID-19 patients has increased in the last week. Our mortality rate is declining, continuing to decline. However, it is important to remember that mortality indicator is a lagging indicator. That indicator will change after cases, positivity, and hospitalization numbers change. In terms of our 7-day average state testing rate, we have plateaued in terms of the number of tests performed, diagnostic tests performed in the state each day. It is important that we increase our testing rate, particularly as cases are increasing. That's important for public health response in terms of being able to ensure that we're identifying cases in order to conduct contact tracing and understand where outbreaks are occurring. Very bright spot is that we have more than 3 million doses of COVID-19 vaccine that have been administered in the state, and almost 25% of Michigan's population, 16 and older, have had at least one dose. Next slide, please. So here we're going to take a quick look at the rest of the nation. I wanted to thank Michigan Medicine for this slide. We're seeing a very different picture than we did a couple weeks ago, the last time we talked. There are now 11 states that are experiencing increasing case trends across a week. There are 22 states with a significant outbreak. And looking at the Midwest, we can see that there are some stable hospitalization rates or continuing decline in a couple of states, but Michigan definitely stands out in terms of having an increase in our hospitalizations and case rates. There are a number of ways that I can show the case rates. If we go to the next slide, this is a graphic that just shows the number of confirmed COVID-19 cases that we report out on the dashboard each day. So this is by date that the state health department became aware of the case. And you can see that the number of weekly reported cases to public health is increasing. And we had more than 13,000 cases reported in the last week. Next slide. The CDC takes that daily case report and turns it into a case rate per 100,000. And this graphic is showing you the Midwestern states that border Michigan. If you look at the tail end of that graphic there, you can see the purple line and the orange line there. That's Michigan and Minnesota. We are different from our Midwestern neighbors, with the exception of Minnesota, in that our cases are, the number of reported cases have been increasing over the last few days. Next slide, please. This also affects our RT rate. So this is our reproductive rate. So the map in this graphic is data that comes from epiforecast.io. It's data as of March 14th. And it's showing you colors for states that are increasing, likely increasing, decreasing. And Michigan is one of several states across the US that have recently begun to see increases. Our RT is greater than 1, and RT at 1 or greater than 1 means that each case is infecting more than one person. And based on some modeling that EpiForecast did, it's expected that our T value will remain greater than 1 in the near future. Next slide, please. Another way to compare between states is to look at, in this case, these are the 7-day average case rates per million population. Gave you a sampling of states there, and Michigan is in the upper right corner of the graphic. And you can see that our line is now light green, which means that we've had less interventions. And our line also has inflected. So we're starting to increase in the number of cases. And we may see New York, Wisconsin, Illinois, Indiana, Ohio, we're seeing some plateauing or decline in those numbers, but Michigan definitely stands out in terms of the increase during this time period. Next slide, please. So let's dig into Michigan data specifically. I did, these data, as it says in the title slide, are from a few days ago. I did look at data last night, didn't have time to update all of the slides, but I did look at the data last night and all these statements are holding true. So we're seeing the same directions holding true here. So our statewide positivity has increased to 5.1% and is either increasing or plateauing in all of the Michigan economic recovery regions. One region, Kalamazoo, has seen a positivity increase to above 7%. And you're also going to see data showing that positivity trends have increased at the county level as well. Our case rates are 144 cases per million. When I looked at the data last night, unfortunately, that case rate is continuing to climb. At 144 cases per million, that was a 50% increase from our mid-February low. 5 of the Michigan economic recovery regions are showing an increase in case rates. And we're seeing increases or plateau in case rates among most age groups, race, and ethnic groups. In terms of variants of concern, Michigan has now identified 2 variants of concern. B117, we have more than 725 cases identified. That's an increase of 162 cases from the week prior. And we also have 1 case of B1351. The number of active outbreaks in the state has increased from last week as well. And we're at 162 school outbreaks that have been reported to us by local public health. Next slide, please. So looking at our postage stamp, you can see that we're back to having the dark purple color on this stamp. 5 MERC regions are showing elevated incidence growth. That means the case rate is increasing. We're also seeing 5 regions with positivity greater than 5%. Want to highlight Kalamazoo. They are at 172 cases per million people. They're continuing to grow and they have a 7.4% positivity. Next slide, please. We look at this slide routinely internally to understand the difference between the number of cases that are reported to us during a week versus the number of cases that may have had their onset of symptoms during the week. So this is just another way to get across that we're continuing to see an increase in cases, and we expect that that increase will continue. Next slide, please. So this is looking at data from mid-December forward. You can see for positivity, daily cases per million, and daily hospitalizations that are, we're no longer in decline. And you can see that we're having a clear increase in positivity, clear increase in case rates. And then hospitalizations that may not be quite as clear, but you'll see in some detailed data below that we're experiencing an increase there as well. The next slide gives us a bit deeper dive into how positivity, so the percent of all tests, diagnostic tests that are positive in a county looks. You can see that our map is starting to darken again. We have 10 of 83 counties that had positivity at 10% of tests being positive or greater. And that's an increase of 8 counties over the past week. And we have 21 counties that have positivity greater than 7%. Next slide, please. So when positivity is increasing, there are 2 kinds of signals that come out of that. One is that we may not be testing enough, so that we need to see more testing occurring in our communities so that we're sure that we're catching cases. The other can mean that our cases are increasing in an area. So it's pretty clear that we are experiencing increase in cases. The case rate increases are really occurring for those who are under the age of 70. So this is a different pattern than we've seen before. On this graphic, 70 is the lightest blue line, the 70 plus age group. So, delighted to see that they are not increasing, and that I think shows a positive impact of the vaccination efforts. Our cases per million are highest among those 30 to 49 and 0 to 29 years of age. And one of the reasons we showed the entire epidemic period here is that we want to make clear that our rates that we're experiencing right now for these age groups are similar to where we were in mid-October. The next slide provides a little bit more granularity in terms of the age groups. So this is looking at age groups by decade. Many of those age groups that are older are plateauing. However, those who are 10 to 19 have the highest case rate, and their case rate is increasing faster than that of other age groups. Age groups with notable increases also include those that are 40 to 49, 20 to 29, 30 to 39, and 50 to 59. Next slide, please. Cases per million are now increasing for many ethnic and racial groups. Case rates are increasing for individuals who are white, Black, African American, American Indian, Alaska Native, or non-Hispanic Latino. Next slide, please. One of the reasons we are concerned about the case increases, of course, are that we are seeing increased spread of variants of concern in the United States, and we're experiencing that in Michigan as well. So if you look at the little chart at the bottom left of this slide, you can see that there are 50 jurisdictions that have reported at least one case of COVID-19 who's infected with the B.1.1.7 variant. And that, of course, includes Michigan. There are 25 jurisdictions that have reported B.1.3.5.1. That also includes Michigan. And there are 10 jurisdictions that have reported P1 or the Brazilian variant. Michigan has not yet identified a case of COVID-19 that's been infected with the P1 variant. Michigan has identified 725 B.1.1.7 cases. This is about 15% of all B.1.1.7 cases reported nationally. We do have a very aggressive testing program here at the state of Michigan as well as University of Michigan. But we've identified at least one case of B.1.1.7 variant in 31 counties in the state. More than half of our B117 variant cases that are tested are within the MDOC system. That is because we've made use of testing around an outbreak within MDOC. And, you know, sorry, let me back that up a bit. Where I'm trying to get to is that as we test around an outbreak, we are going to pick up more B117 variants. However, the take-home message from the slide is that B117 variant is in both peninsulas in the state and has really spread throughout the state. Just a reminder, this variant is more transmissible. So a single case of COVID-19 who's infected with B117 will transmit that virus more easily to others. Next slide, please. In terms of the number of outbreak investigations that local health departments are taking on, we did see an increase in the number of outbreaks by 9% from the previous week. We're up to 645 outbreaks that local health departments are reporting back to us that they're investigating. The largest number of outbreaks are in K through 12 school settings at 162, with 54 new outbreaks reported this week. The next most frequent setting, which is experiencing outbreaks or that have been identified in, are skilled nursing facilities, long-term care facilities, and other assisted living. However, the number of outbreaks in those facilities has been dropping since during 2021. So that's a very encouraging sign, again, about the impact of vaccination. And you can see that local health departments have reported new outbreaks in all settings except outdoor community exposures, as well as agriculture food processing. We have not gotten a new outbreak reported there recently. Something that is really important to understand about how we interpret this outbreak data, we have this column on this chart that gives you visibility. Schools, assisted living facilities, we're conducting testing in these environments, and it is easier to identify outbreaks exist in those environments. They are also required to report outbreaks to us in a way that other facilities are not. So it's important to bear that in mind when you look at these data. So let's take a look at the next slide at the K through 12 outbreaks. As I said, there were 162 outbreaks, which is an increase from 121 that reported last week. And we're seeing increases, particularly in high school setting, now at 105 outbreaks in the high school setting. You can also see in this chart that the range of cases has increased as well. So we're up to at least one outbreak has had 52 cases associated with it in the junior high, middle school age range, and there have been at least one outbreak with 49 cases associated with it in the high school range. Next slide, please. So let's talk about how COVID-19 is impacting hospitalizations. Our hospitalizations and ICU utilization for COVID-19 is increasing. Hospitalizations are up 14% since last week, and that's the third consecutive week that we've seen an increase. There are 6 preparedness regions in the state that are showing an increase in hospitalization trends this week. That includes 2 North and 2 South, which is Metro Detroit area, Southeast Michigan area, and the bulk of our population. The census of COVID-19 patients in the ICU has also risen in 5 regions in the past week. Mortality does continue to decline for the past 12 weeks. We're down to 1.4 deaths per million people as our 7-day average. However, it's important to remember that deaths are a lagging indicator and will change after case and hospitalization rates change. So next slide gives you information on our COVID-19 census in the state in the hospitals within the state. You can see that we're now at 949 hospitalized patients who are confirmed to have COVID-19. This is up 14% from last week. And this growth has accelerated from prior weeks. So 2 weeks ago, we had a 9% increase. At the rate we're going, our doubling time at this growth rate would be approximately 5 weeks. So 5 weeks from now, we'll have almost 2,000 patients in our hospitals in the state. Looking at the next slide, you can see the 6 of 8 preparedness regions are showing increasing hospitalization trends this week. The UP does continue to show declines. 3 regions, 2 north, 2 south, and region 3 are above 100 hospitalized patients per million population in the region. Our next slide gives you the same information for the ICU. You can see the census of COVID patients in the ICU have risen in 5 preparedness regions this week, including 2 north and 2 south. Overall, our census has increased 14%. And half of the preparedness regions in the state have more than 10% of ICU beds occupied with COVID-19 patients. So our hospitals are experiencing increased pressure from COVID-19. The next slide provides mortality rates by age. You can see we're continuing to decline or plateau, and about 11% of our deaths are occurring to people below the age of 60. And then our next slide provides the 30-day rolling average of the daily death rate per million people by race and ethnicity. We are seeing death rates decline for all of these groups, but again, deaths are a lagging indicator. So we could still see that mortality rate change and inflect. So next set of information is giving you a picture of how we're doing for public health capacity. As I mentioned before, our diagnostic testing volume has remained steady, and we need that number to be increasing as we see our positivity increasing. The number of cases that have been sent for public health investigation has increased over the last week. And that has meant that although we've interviewed more people than we did last week, the proportion of all cases that have been interviewed has decreased. And we're continuing to see a very low proportion of people who are of cases who stated that they were quarantining when their symptoms began. I also want to share that the number of contacts per case is increasing. This is expected as we increase people's mobility. However, this will also increase the spread of disease unless quarantining by contacts of cases is taken very seriously. So I'm going to go through the next slides very quickly here. One thing I wanted to highlight on this diagnostic testing slide is that both positivity in both our PCR tests and our antigen tests is increasing. Next slide, please. And here you can see that we had more than 10,000 cases between March 6th and March 12th that needed to be investigated. We reached 51% of those individuals, and less than 30% of them had been quarantining at time of onset. Next slide, please. This graphic is showing you the average number of contacts of each COVID-19 case. And one of the things, so looking at that blue line, you can see that we're reaching number of contacts per cases that is very similar to where we were last fall. Next slide, please. And we have additional indication that people are starting to move about the state more from our Bureau of Transportation statistics. The percent of stay-at-home levels has recently declined to be very similar to where we were pre-COVID. And the number of trips that are taken each day has increased. The next slide provides information from Unicast that is also showing a return towards baseline mobility patterns, particularly for non-essential visits. And this is data based on cell phone data. Next slide, please. So I want to go through some information on COVID-19 vaccination. We are now 9th in the nation for the number of people that are fully vaccinated in the state. We are 36th in the nation for the percentage of our population that has a first dose. If we look at our ranking among those most populous states, which is our peer group that we're comparing ourselves to, we're at about 14th ranked. We've had more than 3.1 million doses reported as being administered, and nearly a quarter of those age 16 and over have had their first dose of vaccine, which is about 2 million people. I am going to highlight our race and ethnicity data are becoming more complete. We're now down to 33% missing race information. And I expect that number will continue to decline with some of the improvements we're putting in place. We've also changed how we're reporting our data on race and ethnicity for vaccination. We're in line with some of the categories that CDC is using. When we made that change yesterday, if you go on our website, you can see that coverage is highest among those of Asian, Native Hawaiian, other Pacific Islander background. So next slide gives you some detailed information about where we stand in our rankings for doses administered and distributed among those that are our most populous states. I also did provide the ranking for all 50 states as well, in parentheses next to the word Michigan. But I did want to spend a little bit of time on the right-hand side of the graphic. The CDC put out an MMWR this week that was looking at the percentage of people who get both doses of their vaccine on time. So if people who have been vaccinated by February 14th, 88% of those individuals had both their doses appropriately and timed. 9% were still awaiting their second dose, but still within an appropriate time frame. And about 3% of people nationally were overdue for their second dose. In comparison, Michigan's numbers are a little bit stronger. We had about 95% of people had gotten both doses. 3.4% were in their appropriate waiting period for their second dose. And about 1.2% of people were overdue for their second dose. So I wanted to give a shout out to all those vaccinating providers, making sure that people are getting back in for their second dose. Next slide, please. You can see some detail about how we're doing with our doses that are shipped and administered. We've had 5 weeks where we have administered more than 300,000 doses per week in the state. And our most recent week, we had administered more than 400,000 doses. And we've accomplished more than 90,000 doses administered in a single day. Currently, our coverage rates for the population age 16 and over are about 25% have received their first dose and 14% have had complete vaccination coverage. Next slide. These are all graphics that you can pull off of our website. I just wanted to highlight that more than 1 million people age 65 and older have received 1 or more doses of COVID-19 vaccine. I was very excited to see that milestone being hit. Next slide gives you information about coverage by race and ethnicity. Coverage rates are highest among those of Asian, Native Hawaiian, or Pacific Islander descent, followed by individuals who are white, American Indian, Black or African American, and Hispanic groups. Initial coverage disparities it's a similar pattern that we see among those who are age 65 and older, but I did want to highlight that for coverage rates, we're at 39% of white individuals age 65 and older have had their first dose of vaccine, and about 28% of those Black and African American have had their first dose of vaccine. Next slide, please. So I'm going to close out very quickly with just a little bit of a comparison of how we stood over the last year. Just want to take a moment of reflection that, compared to other Midwestern states, we were able to have fewer cases per million people during the surge in October and January. Also want to provide some information to you about how we're thinking about balancing factors that influence spread. So let's go ahead and go into our next slide, please. So the graphic on the upper left is giving you our case rates per million people. You can see that Michigan's line is the black dashed line, and we've been able to hold our case rates lower than our Midwestern neighbors during the surge. And we thought that was very important in terms of protecting people's lives. I also wanted to highlight just very briefly that we've done a lot of work in terms of addressing disparities in the state, promoting equitable testing. We want to continue that as we're promoting the use of antigen testing in the state. We've developed a lot of tools, public health tools, for tracing information, providing information to the general public, and those tools are going to continue to be used for COVID-19 response, but will also have implications for other communicable disease responses or, heaven forbid, another pandemic. And then our vaccinations, you can see that we've made a lot of success here, and we're going to continue to push hard and charge through to get more and more people vaccinated. But my last slide, what I wanted to leave you with was a theme of that this is all a balancing act. And it's while we're getting more and more vaccine on board, which will reduce the spread of COVID-19 cases, it's important that we, push the seesaw towards those things that are in the green boxes so that we're reducing the spread of COVID-19. It's important not to give in to COVID fatigue. So we have reopened and the variant is here. So we need to push harder on masking and social distancing. Michigan has very good mask use, but we want to make sure that people are doubling down on that. We want to make sure that people are moving activities outdoors whenever possible. And we want to promote the use of antigen testing. We have a number of very successful pilots and use of antigen testing in a variety of settings. And we want to increase the use of antigen testing so that we can have rapid information to help people get into quarantine, protect their friends, families, neighbors, and coworkers, and reduce the spread of COVID-19. So I'll leave this graphic here and open it up for questions. Thank you, Lynn.
All right. Thank you very much, Dr. Khal. If you wish to ask a question, please raise your hand. I will allow you one question. Please introduce yourself and your outlet once I've called on you. And then we will continue to move on through everybody so we can get as many in as possible. Like, so we do have a short period of time here. All right, we're going to start with Christiana. Can you introduce?
Hi, I'm Christiana, reporter at WILX TV in Lansing. So my question is, what do these increased school outbreaks say about the belief that spread isn't happening in schools? I mean, back a few weeks ago when the governor was suggesting we opened up schools by March 1st in person, now we're seeing these bursts in outbreaks. What does all this mean?
Sure. So as COVID-19 is still circulating in the general population in the state, and we knew that we would see cases that are associated with schools, it is very important that children are in school, able to return to some more normalcy and receive education in an in-person manner if that's what the family has made a choice for their child. So it is important, again, that we are ensuring mask use, ensuring use of quarantine if someone has been exposed, and that we're, getting people tested so that we can make sure that people are not bringing COVID into the school environment.
Thank you. But what do these cases mean? Like, what do these increase in cases mean? Does it mean that it's safe? It's not safe?
So everything that we do with COVID-19 is about risk reduction. This is why we are pushing hard on the use of masks. We're pushing hard on use of social distancing, testing, and quarantining so that we can reduce the potential for exposure to COVID-19 within the school setting.
Thank you very much. We're going to move on to Jim Kurtzner. Jim, go ahead, unmute yourself, ask your question. Please identify your outlet.
Yes, Jim Kurtzner with Channel 7 WXYZ in Detroit. Can we see, since we're television, can we see Sarah? Is she at a computer where we can see her?
I can send you a photo after. She had not been prepared to be on video today based on how she's set up. So sorry about that, Jim.
Okay. So then I'll go to my question. What influence or input do you have with the governor who's making decisions moving forward on possible restrictions or opening more things up? It was big news here in Detroit a couple of days ago on Monday with the focus on the Detroit Tigers, the home opener and the starting of the Major League Baseball season. But right now the Tigers are limited to only 1,000 fans inside Comerica Park, but then there's an indication from the Tigers as well as the governor's office that that's going to be reviewed and that number of 1,000 expanded to allow more people. And there was a lot of criticism about how that original number of 1,000 was determined in the first place and what sort of science or metrics will go into a new decision on expanding that to 1,000 people. That's part one. I'm only allowed to ask one question. So that's part one of my question. And the second part of my question is talking about the vaccines and the numbers of people growing, getting the vaccines. How long will it take for those vaccines to have an effect to drive the overall COVID numbers down? Thank you.
Hi, Jim. This is Elizabeth Hertel. I'm the director of the Michigan Department of Health and Human Services. I can go ahead and address your questions. As far as the epidemic orders and the gathering guidelines that we have been working on continuously for the last year or so, as Dr. Lloyd pointed out in one of her final slides, we continue to encourage moving gatherings outdoors. That is a less risky way to get together, obviously, than indoors. And we continue to look at the data that you just had a walkthrough of and work with stakeholders on their processes and procedures to continue to loosen restrictions in a way that we believe is safe and will not result in, another spike of cases, which we are always concerned about. So it's an ongoing conversation. It's something that we talk about regularly as we look at what is occurring on the ground with case rates and positivity, and working to balance that with the ability to still partake in a number of the events and activities that we all enjoy, and we continue to make those decisions on a regular basis, and we will continue to do so moving forward. On the vaccination piece, working toward what we would consider herd immunity, which is, probably around 90 to 95% ideally. We are seeing, in those environments where we have been able to get a large number of people vaccinated, outbreaks being reduced, as Dr. Khal mentioned, such as nursing homes, where almost all patients have had access, all patients have had access to at least a first dose. And we are working through the second dose clinics with those nursing homes across the state. So certainly we would expect to see widespread vaccination rates have an effect on the case rates across the state and across the country.
Thank you, Director. I'll leave the next question for Eric Lloyd. Eric, please unmute yourself and ask your question.
Hello, this is Eric Lloyd with 9 and 10 News. I was just wondering, in the early graphs you showed that Michigan and Minnesota were on their way up compared to our surrounding states. Now, Michigan is doing better in vaccination administration than some of those states, and our restrictions are either similar or tighter than those surrounding states. So why is Michigan and maybe Minnesota also seeing this spike up when everyone else around us is not?
Sure. So, we do know in Michigan that we do have the B.1.1.7 variant here in the state, and we were one of the earlier states, I think, to identify it here. And we definitely have identified a larger number of cases than some of our surrounding states around us. So I don't know whether it is something about the mix in terms of variant within the state. I think there needs to be more work there to understand exactly why there are differences. However, I would just like to highlight that there are definitely, the very first slide that we started with after the executive summary, that there were 11 states that are seeing increases across the nation. So we, may be seeing some of our neighbors trending in this direction as well.
Okay, thank you. Jacob Kanclerz, go ahead, unmute yourself, ask your question.
Hi there. Yeah, I had a couple questions. One is maybe kind of a piggyback to an earlier one. If the trends in the data that we're showing today, which I heard a lot of increases in terms of cases and positivity and hospitalizations, if they were to continue, I mean, does that lend itself to kind of pausing the reopening of more activities or even rolling back restrictions? And then my second question is, I kind of want to know the why as to why things are going up. And I'm wondering if you guys are tracking the specific cases and outbreaks in some of the industries and parts of the economy that were opened up in the most recent epidemic order and what those numbers are saying. Thank you.
Yeah, this is Elizabeth Hertel again. I think on the first part of that question, we continue to monitor the trends that were outlined here. Our hope is that this is not the beginning of a severe increase in cases across the state. But we will continue to monitor that as we move forward and posting that information publicly on our website so people can also keep track of that. I'm sorry, though, I missed the second part of your question.
Yeah, I'm curious to know, thank you, Director. I'm curious to know if you guys are tracking kind of what's going on in the specific industries and areas that opened up in the most recent epidemic order. I know it covered a lot of different areas, and I'm wondering if we're seeing kind of more cases or outbreaks tied to those particular areas.
Yep. So this is Sarah. I think, the outbreak investigation by site type slide that we have is one of the ways that we track on those industries or settings. One thing I did want to share about the K through 12 environment is that we are certainly identifying outbreaks that are associated with sports. I mean, some of this is, we are certainly paying a great deal of attention to sports and have a sports testing program and that kind of thing in there. But something I did want to highlight, and I think this has been highlighted in some of the CDC work as well, is that the classroom environment itself has not been a strong signal for outbreaks. It tends to be more the activities associated with schools and including sports, but not limited to sports.
Thank you. And we'll let Robin Erb go ahead. Please ask your question. Robin, were you going to unmute?
Yeah, sorry about that. Yes, thank you for taking the question. You mentioned the problem with folks who or the concern about folks who are not quarantining, and I couldn't use my screen grab fast enough to catch that slide. Could you talk to me a little more about, the folks who aren't quarantining? Is this an increase of a problem than we've had before? Is this the continuing kind of, I guess, concern?
Yeah. Yeah. So about, we've been, below 30% of cases reporting to us that they're quarantining at time of symptom onset for quite a while now. It's really a metric that is bouncing between 25 and 30, which means that about 70% of people are out and about. They are not in quarantine at the time that they start to manifest their COVID-19 symptoms. So one of the reasons we are highlighting that, particularly today, is because with the B117 variant becoming more prevalent in the state, that the importance of people quarantining so that they are not passing on a more transmissible virus to others around them is even more important.
Okay. All right, and we'll give one last question. Julie Mack.
Hello. Can you guys hear me? Yes. So I have a two-part question. One is, are you worried that Michiganders are getting a mixed message? There's lots of talk about the economy opening up and people are getting vaccinations and we can resume normal activities, and yet these numbers are obviously alarming and going up. And the second part of my question, which is related, is it possible that this spike could play out a little differently than the fall because so many elderly people or senior citizens are vaccinated that we won't see that same increase in hospitalizations and deaths?
This is Dr. Khal. I can take this one. Throughout this pandemic, as we've learned more and more about the virus, how it spreads, new variants, and also importantly, how to keep each other safe, such as using masks and using masks correctly, we have continued to emphasize those public health measures. It remains just as important today as it was 3 months ago for people to wear masks, wash hands, and socially distance. So I do think that message has been consistent. And also, as far as the relative risk of different activities, outdoors is safer than indoors. Obviously, places where you can wear masks are better than places where you cannot. So I think we do continue to emphasize those core public health messages. And I'm sorry, your second part of your question?
Second part of the question is, do you think that it's possible that this increase will play out differently if you've got, in terms of hospitalizations and deaths, considering the high vaccination rates among older people?
Yes, we are quite pleased. I think, over 60% of Michiganders over 65 have gotten at least a first dose. We've done well in getting people living in our nursing homes vaccinated. So we are in a different place, but we are not near, quite frankly, the herd immunity numbers that Director Hertel mentioned earlier. So while we are hopeful that as we get more and more vaccines into the state and more people vaccinated, we will not see the type of surge that we saw in 2020, but I still think we are at risk. And again, with these new variants that are more easily transmitted, and potentially the vaccine is not as effective, still effective, but potentially not as effective for some of them, that we still have this ongoing public health risk. But certainly promising, the fact that we have these vaccines and getting more and more of them into the state every week.
All right. Thank you very much. I appreciate Dr. Line-Callow, Dr. Khaldun, and Director Hertel participating in the Q&A portion of this, and for Dr. Line-Callow's presentation. I will be sending out the slide deck as well as a link to the recording of this for those that did not get the whole thing or would like to review anything. Thank you all very much and have a great afternoon.
We have photos too sent to our email.
Absolutely, I can do that. All right, thank you everyone.